Dr. Jim Pritchett, and I'm here at the 75th annual meeting of the Association of Bone and Joint Surgeons meeting. I'm here with one of my patients who's had a hip resurfacing, and my talk this year for our group is hip resurfacing in teenagers. I have 105 cases that I'm going to present, and he's one of them. So it's really great that he'll spend this time with us making this video. And I'll let my patient tell you what it was like to have a bad hip and maybe not have such a bad one now.
Well, first I'd like to introduce myself. Hi, I'm Jordan Bogan-Cryer. I'm from Washington, specifically Seattle. I've been playing basketball my whole life at a very high level, I would say. National camps, All-American, things like that. And when I broke my hip, I was 13 years old. I was 13. They were saying things like, you might not play basketball again, along those lines. They had to initially put 7 screws and a metal plate in there. And, man, that was very hard to come back from, I will say that. But I did come back from it, played basketball again. But then I started limping again, and I didn't even notice it. My parents noticed it. So we went to the doctor, and they were like, man, it's looking like he's losing cartilage. They were saying big words that I didn't understand at the time, like vascular necrosis, and that my femoral head was like changing shape. And it was crazy. I was walking with like a crooked leg, limping, and it started to hurt. And they initially said that I would need a hip replacement. And the biggest problem with that was I wasn't done growing yet. So they were saying I had to wait till I was around 25. And I was blessed with parents that weren't going to take no for an answer, because they got multiple opinions. And all of them were saying hip replacement, but all that changed when they told me, oh, we know a guy, Dr. Pritchard, he does hip resurfacing, and we think this surgery will be really good for you. So we met up with Dr. Pritchard, and he told me that I was able to do that surgery, one of the happiest days of my life, not including when I got that surgery, because after that surgery, man, it was crazy. Like, my hip, it didn't even hurt. Like, there was so much pain, and like that, it was gone. There was no more pain. Initially, they were going to keep me out for 5 weeks after the surgery, but I was able to walk 3 weeks after, came back to school a couple weeks early, and that feeling of being on crutches for 9 months, people telling you you might not walk till you're 25, to walking 9 months after, oh, it felt so great. I started playing basketball at I want to say the 6-month mark. Actually, no, about the 4-month mark, I started really playing. And now I'm back to a even higher level than I was before. And that's all thanks to Dr. Pritchard. I owe it all to him. Greatest decision of my life. Things they were telling me was that if I was to get a hip replacement right now, what about when I'm 40 or in the future? There wouldn't be much bone left to get another one. That's also a very good upside about this, is they don't drill too far into your femur. So yeah, it was just, man, it was a lot. There was a lot going on. It was a lot of pain. And after that, all that pain stopped.
How does your hip feel compared to your other normal hip?
Perfect. It feels exactly the same. Like, it feels exactly the same. Better than it was before. I'm actually more flexible on my left side than I am my right. I hurt my left side. But I jump off of my left leg, no problem. Land on it, no problem. I can be a little clumsy sometimes. I get it from my dad. I've taken some hard falls that doesn't really hurt at all. Yeah, this surgery was amazing. Thank you.
Yeah, thanks so much for doing that.
Anytime.